And I am glad we are continuing our discussion on healthcare costs, an issue I know that families in my home state of Washington and across the country are greatly concerned about, as many of them struggle to afford the care they need. And I look forward to hearing from all of our witnesses today about the way administrative costs fit into the big picture. I believe there are opportunities here to help reduce healthcare costs by reducing complexity while maintaining quality and safety for patients. We know the current administrative system is fragmented with different federal, state, and private protocols for things like billing and measuring quality of care and more. So I'm interested to hear from our witnesses about ideas to simplify and align requirements while maintaining protections that ensure patients are getting safe, quality care and service. Unfortunately, instead of pursuing policies to address high administrative costs, President Trump is pursuing a path of healthcare sabotage, including ideas that will make this problem actually worse. In fact, the Trump administration's Office of Management and Budget is currently reviewing a new sabotage step that will do even more to let insurance companies offer junk plans that not only undermine important protections for people with pre-existing conditions, but also ignore requirements that insurers spend most of their money on patients, not on excessive administrative costs or executive bonuses. An analysis from the National Association of Insurance Commissioners shows the most popular short-term junk plans, like the ones President Trump wants to expand, spend, on average, half of their revenue on things that have nothing to do with patients' health care needs. In other words, President Trump wants to make it easier for insurance companies to discriminate against people with pre-existing conditions and reward themselves for it with bigger executive bonuses. I think we can all agree we should be looking for steps to reduce administrative costs to make health care more affordable. And this idea from President Trump, I believe, moves us in exactly the wrong direction. Unfortunately, with this administration's focus on sabotaging families' health care, efforts to raise health care costs have become par for the course. From day one, President Trump has focused on rolling back families' health care and protections for people with pre-existing conditions, even though the people across the country have utterly rejected that backward agenda. Like a year ago, when they stood up and spoke out against the mean-spirited Trump care bill that tried to spike premiums, gut Medicaid, and put families back at the mercy of big insurance companies who could jack up prices for people with pre-existing conditions. Fortunately, those efforts failed, so President Trump now has decided to sabotage health care from the Oval Office instead. He dramatically cut investments to help people understand their health care options and get covered. He pushed a partisan tax cut bill that meant lower rates for massive insurers and drug companies, higher premiums for families. He handed the reins back to insurance companies by looking for ways to make it easier to sell junk insurance that dodges patient protections like those for people with pre-existing condition, women, seniors. He abandoned patience in the court of law by having his Justice Department take the highly unusual step of refusing to defend pre-existing condition protections in court. And now many of us are concerned President Trump has nominated a Supreme Court justice who will strike down health care for millions of Americans. Judge Kavanaugh's history on health care makes clear he is a serious threat to families' health care and protections for people with pre-existing conditions. So I hope Republicans join us in rejecting his nomination, just like they joined us in rejecting Trump care when it threatened our families across the country. And I also hope they will come back to the table to work with us on legislation to bring down health care costs, because I know that's what families in my state are counting on us to do, and I have no doubt patients across the country feel the same way.